Welcome to this YouTube channel. In this video we are going to talk about the 10 signs that your blood pressure level is high. So before starting this video, like this video and subscribe to our YouTube channel for future updates. One of the most serious aspects of hypertension, often known as high blood pressure, is that you may be unaware of your condition. Nearly 1/3 of persons with high blood pressure are unaware of it. That's because unless it's quite severe, high blood pressure has no symptoms. Regular checkups are the best way to determine if your blood pressure is high. At home you can also keep track of your blood pressure. If you have a close relative with high blood pressure, this is very significant. Hypertension or high blood pressure happens when your blood pressure rises to dangerously high levels. The amount of blood going through your blood vessels, and the degree of resistance the blood encounters, while the heart is pounding, are factors in determining your blood pressure. Atherosclerosis is exacerbated by narrowed arteries. Your blood pressure will be higher if your arteries are narrowed. Increased pressure can lead to health problems in the long run, including heart disease. Hypertension is a very prevalent condition. Indeed, since the rules were recently updated, it is projected that over half of all individuals in the United States will now be diagnosed with this disease. The following are 10 symptoms that your blood pressure is too high. Number 10. Pounding in your chest, neck, or ears. If someone's blood pressure is excessively high, they may have headaches, weariness, or confusion, as well as chest pain, an irregular heartbeat, blood in the urine, or a pounding sensation in the neck, chest, or ears. When a person feels pulsating or hammering in their ears or chest without exercising or exerting themselves, it could be a sign of high blood pressure. The pounding could be caused by a variety of factors, including excessive caffeine consumption. Anxiety can have the same effect, so it's crucial to keep track of what you're drinking and how you're feeling. Number 9. Blood in the urine. Microscopic hematuria is the term for this condition. Hematuria occurs more frequently in people who have large kidneys and high blood pressure. The bursting of cysts or the small blood arteries around cysts is assumed to be the cause. Infections of the kidneys or bladder as well as kidney stones are possible causes. The term microscopic refers to something that is so small, it can only be seen through a microscope. The term hematuria refers to the presence of blood in the urine. If you have microscopic hematuria, your urine contains red blood cells. However, because these blood cells are so little, you can't detect blood when you urinate. Number 8. Blurred vision. High blood pressure, in addition to causing heart and kidney problems, can also impact your vision and lead to eye damage if left untreated. The blood vessels in the retina area at the back of the eye, where pictures focus, can be damaged by hypertension. Hypertensive retinopathy is the medical term for this condition. If hypertension is not addressed, the consequences might be severe. The tiny delicate blood arteries that provide blood to your eyes can be damaged by high blood pressure, resulting in damage to your retina, retinopathy. Damage to the retina, light-sensitive tissue in the back of the eye, can result in bleeding, blurred vision, or complete vision loss. Mild to moderate hypertensive retinopathy seldom causes symptoms, and it is usually diagnosed during a routine eye checkup. Headaches and eye issues are common symptoms of more severe and rapid hypertension. Prenatal treatment is necessary because severe retinopathy can arise alongside high blood pressure throughout pregnancy. Number 7. Irregular heartbeat. Electrolyte imbalances or heart rhythm abnormalities can cause high blood pressure and a fluttering sensation in the chest, arrhythmias. Temporary situations such as stress reactions, anxiety, panic attacks, or excessive coffee intake can also cause these symptoms. The heart's fine-tuned calcium regulation system becomes unstable in situations of heavy, prolonged mechanical pressure, resulting in irregular heartbeats. High blood pressure may cause arrhythmias, which can lead to sudden cardiac death, heart failure, and stroke. Number 6. Difficulty breathing. High blood pressure in the loop of veins connecting the heart and lungs is known as pulmonary hypertension. A telltale indicator of the disease is shortness of breath. It's because the right side of the heart is having difficulty moving blood flow through the lungs, and it's not getting to the left side of the heart and body, according to McLaughlin. It stresses the right side of the heart, which isn't used to fighting against high pressure. The arteries in the lungs of patients with PH are obstructed or constricted. As a result, the mechanism responsible for transporting new, oxygenated blood into the left side of the heart and ultimately to the rest of the body is compromised. Fatigue, lightheadedness, chest pain, racing heartbeat, and swelling in the ankles or legs are also signs of PH. Despite these clear signs, pH is frequently misdiagnosed. Your primary care physician will rule out the obvious things first, such as asthma or another heart or lung disease, according to McLaughlin. Number 5. Chest pain. High blood pressure damages your arteries by making them less elastic, reducing blood and oxygen flow to your heart and causing heart disease. Furthermore, decreased blood supply to the heart can result in chest pain, also known as angina. The majority of persons with high blood pressure have no symptoms. People with high blood pressure may experience a pounding sensation in their head or chest, lightheadedness or dizziness, or other symptoms. Number 4. Fatigue or confusion. A blood pressure reading of 180 mg of mercury, mmHg, or more for the systolic pressure, first number, or 120 or more for the diastolic pressure, second number, is considered hypertensive crisis, second number. It's usually caused by forgetting to take medications or having secondary high blood pressure. High blood pressure, also known as hypertension, is sometimes referred to as the silent killer since it often goes unnoticed. Fatigue and chest aches, on the other hand, are two of the few signs of high blood pressure. Fatigue from high blood pressure can be caused by a variety of factors, including the condition's effects, medication treatment, and lifestyle decisions. Because of the increased strain on important organs such as the brain, heart, and kidneys, high blood pressure induces fatigue. Medication, on the other hand, frequently plays a larger role in weariness than the underlying disease. Many blood pressure drugs come with a list of adverse effects, including fatigue. Blood pressure drugs can reduce the heart's pumping function, while diuretics can cause electrolyte depletion. As a result, the body produces less energy, resulting in greater exhaustion and fatigue. High blood pressure might induce unexplained weariness that doesn't seem to have a cause. Number 3. Nosebleed. Although high blood pressure isn't known to cause nosebleeds directly, it's possible that it makes your nose's blood vessels more vulnerable to damage and lengthens bleeding time. In most cases, nosebleeds are not a sign of excessive blood pressure. However, whether those with high blood pressure have more frequent or severe nosebleeds is still debated. Number 2. Excess sweating. High blood pressure can be caused by certain conditions, or it might happen for no apparent reason. Temporary situations such as stress reactions, anxiety, or panic attacks can cause blood pressure to rise. Fatigue, perspiration, and flushed skin are all symptoms of hormonal shifts, but they can also arise as a result of a variety of disorders. If you're worried about your symptoms, talk to your doctor. Sweating is a natural way for your body to cool down. When your body temperature rises, your neurological system naturally activates your sweat glands. Sweating is also common when you are frightened or stressed. Your age, sex, posture, and food, as well as the environment where you reside, all have an impact on when and how much you sweat. Sweating is influenced by your body's circadian rhythm, which is a 24-hour internal clock that helps govern your sleep and wake habits. Number 1. Severe headaches. During a hypertensive crisis, the pressure in your cranium rises, when your blood pressure rises to dangerously high levels. The resulting headache is unlike any other migraine or head discomfort you've ever experienced. Aspirin and other traditional headache remedies are unsuccessful in relieving pain. Those suffering from a headache, no matter what the source, want relief as soon as possible. If you have been diagnosed with high blood pressure and are taking medicine to manage it, you must be careful about which treatment you choose. Always read the label on your meds to ensure that the method you chose to treat your headache won't do more harm than good. Regardless of whether you believe high blood pressure is a direct cause of your headaches, talk to your doctor about your symptoms. High blood pressure and headaches can both be influenced by certain lifestyle choices. One technique to enhance circulation and reduce stress is to go for a walk first thing in the morning. Another strategy to keep your blood pressure in check is to eat a lot of green, leafy vegetables and anti-inflammatory meals. Potassium and magnesium are two nutrients that are critical for heart health. Make sure you're well informed and that you're taking any meds your doctor recommends. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.